Hey guys, Dr. Chris here with Mid-Atlantic Chiropractic Center. Today we're going to be talking about runner's knee. Runner's knee, also known as patellofemoral pain syndrome, is a condition involving the kneecap and the femur, which is the main leg bone. It's not only present in runners, it's present in anybody. Typically, we see it in people who are doing overuse activities such as running, biking, walking, squatting, lunging, things like that, where you're putting that repetitive motion through the knee. You're more common or susceptible to runner's knee. So some things that we can do for treatment include, let's get you out of pain. So first thing, resting, icing, decrease that inflammation. Once you're out of pain, you're able to move. We need to work on strengthening the stabilizing muscles. So the quadriceps, the hamstrings, the calves, the hip muscles as well, to help stabilize the knee joint. We also need to make sure you have proper biomechanics when you're doing your activity, whatever it may be. So we need to make sure your knees are in proper alignment, the feet are in proper alignment, the hips are in proper alignment to help prevent you from suffering from that condition. We also need to make sure that you have full range of motion, so working on the flexibility so that way you're able to perform to the best of your ability. Common symptoms associated with runner's knee include pain of the knee joint, so pain around the kneecap. You may also hear that popping, clicking, catching, grinding sensation behind the knee or around the knee. Pain or stiffness when you're doing activities such as squatting, lunging, biking, walking, running, things like that. You may feel stiffness or pain while you're doing that. We as chiropractors can help with runner's knee. First things, we can do a very comprehensive assessment to look at your biomechanics, your range of motion, your strength, to determine where some of the deficiencies may be within your movement to see why you're suffering from this condition. So we can look at your arches, see if there's fallen arches where the foot actually overpronates, which that will affect you from the ground up. We can look at the knees to see if there's a valgus force being placed on the knee, which will predispose you to runner's knee. We can also test the muscles within the thighs and the hips to make sure you're strong enough and have the proper range of motion that you need to do your type of activity. So here in the office, we have some technology that we can use to help us with that. We do have a foot scan system that uses lasers to scan the bottom of your feet to determine if you have fallen arches, or you may benefit from the use of an orthotic to help stabilize those arches. We can also use laser therapy to help get you out of pain, help decrease inflammation, and create a healing environment within the knee. That way we get you on track to performing sooner. We can also give you strengthening and stretching exercises to help work on the muscle imbalances within the lower extremity. So the hips, the thighs, the lower leg as well, to determine where the deficiencies may be. We're also trained to look for malalignments or misalignments of the feet, the knees, the hips, to determine where your biomechanical disadvantage may be. So we can look for those things, give you corrective exercises, and adjust those areas to help improve those alignments as well. That way you're able to perform to your best ability without that discomfort of the runner's knee. I hope this was helpful. If it was, if you have any questions, let us know down below. Give us a like, follow, and subscribe for more information. Dr. Chris, take care, guys.